Physiological impact and management after terminal ileum resection, a deep dive for the curious mind. Welcome back to our channel. Today, we are taking a closer look at the physiological consequences and management strategies that arise from the resection of the terminal ileum, the most distal segment of the small intestine. If you are fascinated by the complexities of human physiology or interested in understanding what happens when this critical region is surgically removed, this discussion is for you. Let us begin by understanding the specialized roles that the terminal ileum plays in our bodies. This section of the small intestine is not just a conduit for digested food. It serves vital functions in absorbing crucial nutrients and regulating digestive processes. First and foremost, the terminal ileum is responsible for the absorption of vitamin B12. This happens through receptors that specifically bind to the intrinsic factor and B12 complex, allowing our bodies to access this essential vitamin. When this segment is removed, individuals are at risk of developing a form of anemia that resembles pernicious anemia, as well as neurological symptoms, including degeneration of the spinal cord, all resulting from vitamin B12 deficiency. The terminal ileum is equally critical for the reabsorption of bile acids. These acids, after aiding in fat digestion, are usually recycled through a process known as enterohepatic circulation. With resection of this region, bile acids are not efficiently reabsorbed. If less than 100 centimeters of the ileum is removed, the liver may attempt to compensate by increasing bile acid production. However, should the resection be more extensive, the body cannot keep up, which leads to fat malabsorption, known as steatorrhea, and deficiencies in vitamins A, D, E, and K. Moreover, when unabsorbed bile acids reach the colon, they induce secretory diarrhea, sometimes referred to as bile acid or choleric diarrhea. Another function of the terminal ileum is the absorption of fluids and electrolytes. Losing this absorptive surface means that more fluid flows into the colon, resulting in frequent diarrhea. Let us not overlook the importance of the ileocecal valve, which serves as a gateway between the small intestine and the colon. This valve regulates the passage of intestinal contents and guards against the backward flow of bacteria. If this valve is removed during surgery, the consequence is rapid transit of material through the intestine, which worsens diarrhea and increases the risk of small intestinal bacterial overgrowth. Now, what complications can patients expect following terminal ileum resection? In the short term, postoperative ileus is common, as is the risk of infection or leakage at the site where the intestines are reconnected. There can also be disturbances in fluids and electrolytes due to ongoing diarrhea and malabsorption. The long-term complications are equally significant. Vitamin B12 deficiency, for example, may take years to manifest because the liver stores this vitamin. Bile acid diarrhea is more likely if less than 100 centimeters of the ileum is removed, while steatorrhea becomes prominent if a longer section is lost. Deficiencies in fat-soluble vitamins can lead to bone disease from lack of vitamin D, increased bleeding risk from vitamin K deficiency, and other health issues. A lesser-known but important consequence is the formation of kidney stones. Unabsorbed dietary fats bind to calcium, leaving oxalate free to be absorbed in the colon, which can lead to calcium oxalate kidney stones. Reduced recycling of bile acids can also increase the risk of gallstones. Should the surgery be extensive, patients may develop what is called short bowel syndrome, characterized by severe malnutrition and dehydration, sometimes requiring long-term intravenous nutrition. So, how do we manage these challenges? For vitamin B12 deficiency, lifelong replacement is crucial, either through injections or high-dose oral formulations. Bile acid sequestrants can help control diarrhea when a shorter segment is removed. Dietary modifications, such as low-fat meals and supplementation with medium-chain triglycerides, are recommended for those who experience steatorrhea. Supplementation with fat-soluble vitamins is also essential, as is calcium to help prevent kidney stones. Antidiarrheal medications might be prescribed to slow intestinal transit. In severe cases, parenteral nutrition may be necessary. To summarize, the resection of the terminal ileum disrupts vital physiological processes, affecting bile acid recycling, vitamin B12 absorption, and overall fluid balance. The range and severity of complications depend on how much of the ileum is removed and whether the ileocecal valve is preserved. Successful management hinges on replacing lost functions and anticipating malabsorptive consequences. Thank you for tuning in. If you found this episode insightful, be sure to subscribe for more deep dives into fascinating medical topics.